your clinic. I believe that the topic today I'm going to address as the knife needle therapy. It's been already spreading all over the world. It's been more than 30 years. It started in China, and in many countries has been adopted already as an important tool for the certain conditions. So how do we refer to it? If it is acutomology or acutomos medicine or acutomology or something like that, it's the same thing. Is that we use this type of needle which has a sharp edge, that like a scalpel. So it is used to cut, but this is a very, very thin needle, as you will see. But then I'm sorry, wait a second, I don't know what's going on here. Okay. Well, today I'm not going to go into any detail on the history, how it started, how it was developed. We don't have enough time. And I just want to share with you a little bit of my experience on the use of this particular technique. There's always the conflict on referring to acupuncture, acutomology as a part of acupuncture. And just to say it is not a part of acupuncture, is not on the practice of acupuncture that it needs to be included as a main topic, but it was among acupuncturists and following some of the principles of acupuncture that it was developed by the famous Dr. Tru Han Trang. Anyway, as you see, it is a type of invasive in a way that is more invasive than an acupuncture needle. And for many, even an acupuncture needle is considered to be invasive, not to me. But then if you consider that the use of a knife needle, a little bit thicker needle with a sharp edge that will cut tissue, definitely it converts it in a little bit more invasive technique. And sometimes depends on also on the thickness of the acutum and on the tissue that you're going to be using, and the part of the body you're going to be using. It could be or not more painful. It could be painful. That's why many times now we recommend the use of a local anesthetic to do the procedure calmly, carefully, and without causing the patient a lot of pain. So far in China, when we learned it, in most of the conditions that we studied, they didn't use anesthesia or local anesthesia, but we do use it in certain conditions. And as I was saying, depends on the thickness of the acutum, then we could decide what to do, if we could add or not the comfortability of the use of a local anesthesia. The thing that it comes from the very beginning, that it is indicated mainly for pathology related to soft tissue chronic injuries. What is what we say, we refer as soft tissue structures or the soft tissue injuries. Most of the things which we address in our practice of acupuncture somehow is the treatment of tendons, ligaments, skin, joints, muscles, fascial conditions, and mainly most of the time these are related to limitation, to pain, and other conditions that I would refer later on. Anyway, the thing is that a chronic condition, it is related to the effect that is caused to the certain tissues that after a certain time will be continuously irritating and creating a inflammatory response, let's say, in a way. So physical movements, sports, postures, lifting heavy objects, obesity will create a burden to the joints, to the ligaments, to muscles that after a certain time will be repeatedly causing trauma that will create a response inside the body that will lead to the alteration of the movements, the alteration of circulation, alteration of movement, and many other things that are created after the stress is involved, affecting those tissues in the body. As It's a very clear, a very easy to understand how the mechanism of injury develops through the time, through the years. As we can see on the right-hand side, you see how the mechanical stress will create this damage, and this damage-related molecules will be released and affect the extracellular matrix, and the decreased oxygenation will create increased apoptosis. How all these procedures, I'm just simplifying them in a very, very easy way, will create some kind of reaction like scarring, like fibrosis. So on the other hand, if you see it from the perspective of Chinese medicine, and we could always find a way to connect it, the two systems, the structures that we have will have also some weakness that could stay there from inheritance, and people are more prone to develop certain kind of injuries in the spinal, in vertebrae, or in certain joints. But of course, the activity that you do, the exercise, type of profession, type of activity will also be a part of it. But then, if you have a spleen, stomach, liver system weak, you will probably are more prone to develop certain conditions in muscles and tendons, which are supposed to be controlled by this particular TCM system. Of course, if you are exposed continuously to climatic changes, to the external pathogenic factors like wind, cold, and dampness, remember that in Chinese medicine, we refer to the P syndrome as a result of the attack of these external pathogenic factors that create blockage in the channels, will create inflammatory process, will create pain, will create limitation. So the obstructions of the circulation of channels and collaterals at the end will be caused by the stagnation of blood and energy. If there is a blockage in the circulation in the channels, then pain will occur. If there is a blood stagnation process or a blood energy stagnation process, will also be the starting point to create blood stagnation and fibrosis. Fibrosis is, in a way, a kind of blood stagnation combined with probably with the humidity and phlegm and chi stagnation as well. And that fibrosis definitely will cause not only pain, but also movement limitation. So that is why we need to do something to get rid of that fibrosis, to liberate, to free the structures, the tissues from that scarring or that stagnation that has been created in the body. And that blockage in the body it will be creating, of course, pain. That is the main situation that makes the patient comes to our clinic. It will cause a lot of functional limitation. You can perceive a zone where you can feel actually a kind of a site of induration or scarring that you can palpate it through the skin, and it reflects that something is going on. Of course, through X-rays and other things, you could see a calcaneus spore or other fibrotic tissues created in certain areas through diagnosis through X-ray. But definitely you could see joint deformation, and you will always find different types, different areas, small and larger areas of pain, which you also need to take care of those. So there are many, many conditions which could be related to the chronic soft tissue injury, and mainly, as you can see here listed, are the ones related to the musculoskeletal system. Of course, chronic pain, and some of the conditions that you see here are being treated. In my experience, I've been treating all of these conditions have been treated, and I can share with you that we can get good results. Most of the time in my acupuncture practice, I do deal with this kind of conditions, and I don't need Acutom or knife needle to solve them. Usually with the regular acupuncture and other complementary or related techniques to acupuncture, I can say that I'm able to completely solve these kind of conditions. But there are certain conditions which did not respond as good as I was expecting, or it's taking longer, or the condition is a little bit more severe, that will attract my attention to consider the use of the Acutomos. So whenever I decide to use Acutomos, most of the times is when I already took care of what it was. I studied very clearly the condition of my patient. I did all the studies that needed to rule out any other severe conditions and to see if Acutomos will be a good choice for treatment. Well, here is the tool that we use. Here's the Acutomos. Acutomos, however you want to call it. Knife needle, scalpel needle, however. So it has a handle, and usually the handle will tell you what is the direction of the sharp edge. So as you see here, the cutting tip, the edge is parallel to the handle. So then you can tell where is the direction of the cutting edge that you will be aware of, because this is very important to proceed with the treatment when you're going to separate the fibers, the fibrotic tissue. Here, as I said, there are different thickness, from the very thin one. Nowadays, even we can use more and more thin Acutomos. The most frequently used nowadays is around 0.4 millimeters of diameter. And if you are aware that the acupuncture needle, the most frequently gauge used is 0.30, 0.40 is not that big difference. So it's very, very needle. And from 0.40 to 0.60, even maybe up to 0.80 is the maximum thickness that we use with Acutomos. So it's not that strong, or it's not that thick, it's not that aggressive, it's not that invasive, as I was saying. So how we do it? Of course, we make the diagnosis, and then from there we start. We prepare the material. What material we use? We prefer to use a sterile field with gloves, a syringe to put the anesthesia, the Acutom, 1 or 2, depends, an antiseptic solution, and a marker to mainly when you detect or you explore the area and you want to see exactly where you're going to perform the technique, you use a permanent marker, which is in that picture, and then you have a gauze. Many times, even this system could be designed even to do it one person without any help. Of course, it is much faster, much easier if you have someone assisting you. You have to take care of the posture, the appropriate posture of the patient. If he has to be laying down, laying on prone, or supine posture, or seated, whatever, where is the area you're going to treat, then the way you're going to put your patient. This is in the shoulder, in the scapula. Then you have to, as with any kind of surgery, you do a proper asepsis and antisepsis, you apply anesthesia, and then you go for the manipulation technique. Here you cannot see it probably, how the tip of the Acutom enters parallel to the direction of the fibers of the muscle or tendon or ligament that you're gonna do the treatment. Imagine that there is a scarring tissue in that area, and you're gonna take it as a relation to when you palpate, when you explore. You have to be very careful with the relations of the insertion and the origin of a ligament or a tendon or a muscle, because you always have to be very close to the bone and give as a guide to how deep and how you could move the instrument in the body. You do not go and penetrate as deep as you want. You just do not separate it from the bone and probably penetrate an organ. You have to be very careful. You have to keep that as in mind, as you can have to know very clearly the anatomy and always stay close to the bone as a reference. Okay, once the desired depth is reached, then you slide the Acutomos vertically 2 to 3 millimeters. Here it is what we say, it is a cutting defibrillation. Defibrillation is the action of separating the fibrotic tissue. So first you do this kind of cutting, and even you can just go backwards and downwards, and in that direction, trying to cut as much as fibrotic tissue. It's very simple. You just have to do it 5 times, maybe 10 times. I said probably 3 to 5 times, but it depends how do you feel the crepitation. Once you are in that area, you will not only feel it, how the tension on the fibrotic tissue is stronger than in a regular tissue, and then you feel it, how you are cutting it, and how it even sounds. It keeps a crepitation sound that not only you can hear it, but also the patient. Okay, so then just to follow, then after doing the cutting, you do what we call a non-cutting movement, which also it helps you to separate, to move apart, to loosen a little bit the structure, the construction of that area. So it helps to widen the area, to promote circulation, and to be able not to recover the closure and the tension that the fibrotic tissue has been causing in the area. So then at the end, we do this kind of movement. You can do it in one direction, left and right, and then to the one side and to the other. So to the left hand side, part to the surface of the tissue. So to detach the fibrous tissue. So that is the technique. You will see it now here in a very short video clip. So here, as you see, well, this is stenizing. This is the trigger finger, stenizing tenosynovitis. It's painful and limits a lot the movement. You can feel it, feel the lump when you palpate it. It's very, very clearly how it is being marked. Can you see how I'm getting the acutomos and directing the sharp and the same parallel to the direction of the tendon? Here you could see probably the sharp edge. Where is the? So I could do it in that direction, and you'll see very easily. I did some local anesthesia, so the patient will not feel anything, not any pain at all. You see how deep I go inside and I'm doing the cutting. I move in different directions and on the same spot. Okay. The patient is feeling that crepitation. It's audible, it's very, very clear. Then I move it. And now the next step is moving it without cutting. See, as more or less as I pointed out in the dummy that I showed earlier. Yeah. Do as you feel. I mean, I was still feeling a little bit of hardness, and I wanted to get rid of a little bit more, so I repeated the procedure 2 times mainly, but it didn't take more than 3 minutes probably. And now it's out. And what happened? Sometimes even not a drop of blood will come. So then here you can see at the end, this is the same patient. I just started a kind of a stretching and movement. From now, of course, the patient has a numb sensation because it still has the effect of the local anesthesia. And if you ask him to move the finger, this guy, she will not feel any pain. And immediately she will probably perceive recovery of the limitation, will have less limitation. And as what I'm doing, I'm giving a pressure and massage, trying to open a little bit more, trying to kind of to spread a little bit more the fibrotic tissue, and that's it. Many times, just even one treatment could be enough when it's a mild condition. Sometimes I can repeat this in a 2 weeks time, and 2 times, I think not more than 3 times has to be done in order to completely cure this condition. So, as I said, the use of this technique, the use of this tool, which could be very good, I would say recommend that only selected or mainly selected for chronic conditions where fibrosis could be identified. You could obtain very good, great benefits, but you have to be very clear, very aware, to have to study the anatomy and to understand what is the underlying mechanism that, or the pathophysiological mechanism that created that problem. Of course, as I show in the video, you have to do this stretching. And again, continue rehabilitation, continue avoiding the risk factors. And of course, sometimes some patient will, after the anesthesia has gone, the effect of the anesthesia, local anesthesia has gone, they probably experience a little bit of pain. If they want, they could have an anesthetic, some analgesic, but most of the time they don't even need it. So that is it. Consider this technique to be part of your tools in your clinic. I highly recommend it. Thank you very much. This is all for today. Thank you.